Hello and welcome back to the Cold Start Corner. I'm Eric Matei, and in today's episode, we are talking about growing optometric specialties for new practice owners. Now, look, obviously, growing public health demand for vision, medical, and elective eye care has really spurred the evolution of many fascinating specialties across modern optometry. So today, we are talking about these insights for emerging and new practice owners that are eager to grow an optometric specialty in their cold start or add a specialty to that recently purchased practice. So we're going to kick it off by just, assessing the economics of modern optometric specialties, right? So look, the vast majority of the population does have a need for vision, medical, or elective eye care. And to meet this growing public health need, well, it's where we're seeing the scope of modern optometry continue to expand. So while the list of these specialties is big and continues to grow, the economics of all these different specialties share three key characteristics that can really have a tremendous impact on practice financial performance. So the first of these is going to be that, specialty care involves more direct pay revenue than routine methods of care. So, once upon a time, the economics of managed care were rather simple, right? Connect patients and providers. However, through consolidations, the role of vision care plans, and a whole slew of things, quite frankly, the process has become quite complicated, right? Once again, vision plans have moved in, adopted sophisticated revenue models that now include owning various segments of the supply chain, so materials, labs, et cetera. And in some cases, these vision plans even own optical chains that are operating direct competition with private practice. So the fact is, we've seen that with this shift, we've seen some of these more conventional profit centers of the practice are now no longer that. So once again, as more and more of that revenue is now coming from managed care and less direct pay from patients, right? So these optometric specialties involve significantly more direct pay than some of these other routine methods of care that have that involvement of third party, right? And second key characteristic regarding the economics of specialties is that, private practices comprise the largest segment of early adopters of these emerging and specialty care. So now you see this at various points throughout the evolution of modern optometry. And I mean, I guess most recently seeing, just the adoption of medical care, surgical co-management models. We look at contact lenses, adoption of daily disposable and especially contact lenses, and a slew of other areas, right? So, because the fact is this, free of the rigidities of the bureaucracy and operational commitments that constrain larger corporations, smaller enterprises can remain agile and really positions them to adapt and implement change rapidly. As such, private practice can benefit from these economic principles of organizational behavior to grow a thriving specialty where corporate, network, and hospital-based practices are going to struggle to compete, right? And the third key characteristic regarding the economics of specialty optometric care is that, practices that provide modern specialties enjoy a higher net profit, right? So specialty care it's not a commodity. Therefore, the practice benefits from a variety of economic principles that allow for a sizable return while facing minimal competition. But it's only for those that are willing to go for it, right? So specifically, given the lack of competition and the outrageous demand for these specialties and emerging care models, enterprising providers can really realize a pretty significant profit potential. So we kicked it off by talking about just the economic principles that are characteristic of optometric specialties. But now let's talk a little bit about how to add and grow it in your new practice, right? So look, planning, developing, and launching a sustainable optometric specialty, it definitely involves some lifting, right? So it involves implementing a strategy that's really optimized across 5 key areas, that being financial analysis, office and flow, technology and equipment, operations and people, and marketing. So let's kick it off by reflecting on what we're talking about with the financial analysis that goes into adding a specialty to your new practice. So look, creating a financial pro forma is critically important to determine the financial feasibility of any area of the practice. So with regard to growing a modern optometric specialty, your financial analysis should include an itemized list of all the startup costs associated with the specialty, including equipment and technology, furniture and design elements, construction materials and renovation costs, any sort of team training expense, marketing, right? Definitely cash flows of the specialty over a minimum of 3 years, right? You'll want to be sure to carefully include all of your overhead and any COGS, right? Cost of goods, any COGS that are relevant to that specialty service area. And lastly, be sure there's a realistic volume that you're projecting in your pro forma, right? So we really want to establish these clearly defined benchmarks to ensure the long-term success. And mind you, the benchmarks and targets that you're going to set here in your financial analysis is actually going to inform your marketing strategy and conversion goals. It's going to be discussed a little bit later here. So when conducting your feasibility analysis, also be sure to take into consideration realistic capacity when identifying those benchmarks. And lastly, definitely be sure to include your debt service requirements for any startup cost that you'll be financing to really clearly identify the break-even targets and establish that accurate cash flow forecast. So with a check next to your financial analysis, the next step to implementing that specialty in your new practice is all about office and flow. So now, the physical office space is another critical factor in the success of this modern specialty. So the ideal location should be optimized across 3 considerations. First, that the location and build out is really going to suit the marketability of the specialty. So this is where like geospatial analysis, you'll want to be sure you include like really robust local market and demographic research. It's really going to empower you to select and optimize that site based on your ideal patients and households. Secondly, from the standpoint of location build out, office and flow, right? Secondly, be sure there's design elements, that interior design and all the spatial elements should be optimized for the ideal patient flow with an emphasis on that patient experience and operational ease. Lastly, the cost of the space, both the startup costs of the build out and the ongoing occupancy expense must be accurately reflected in that financial model to really ensure the feasibility of adding the specialty to the practice. So we touched on the financial analysis. Now we've touched on that physical office, right? That office and flow. Now let's dig into technology and equipment. Because the fact is this, utilizing technology across your practice is going to present you with radical opportunities when establishing a specialty in your new practice. So for the modern practice, these technologies include a host of digital solutions, advanced diagnostics, specialty clinic equipment, and it is necessarily really to delight patients, obviously also on the standpoint of systematizing workflows. Definitely don't overlook, when we're talking about technology and equipment, don't overlook the role of SaaS solutions and just helping streamline workflows from both your team standpoint and the patient perspective. So when you're compiling those technology requirements for the specialty, once again, look for ways to engage patients. Look for opportunities to provide self-service solutions that are going to enhance that patient experience and differentiate your practice big time. And also, here when we're talking technology and equipment, when adding a specialty to your new practice, be sure to accurately itemize all the technology and equipment costs, right? So if we go back to that financial analysis, ain't it funny how the financial analyses always raise their head here? But definitely in the front of technology and equipment, be sure to update that financial pro forma with accurate numbers. So next up, we're talking about adding a specialty to your new practice. We're talking about operations and people. So obviously establishing a thriving specialty in your modern practice is going to require numerous operational considerations. Now, for the cold start, you actually have a big advantage as a cold start, right? Because you're not limited by, it's the way we've always done things whenever you're implementing something new. So you're really in a position to optimize your operations and your team to grow that specialty. So start by defining and documenting the specific standard operating procedures or SOPs that are going to be associated with that specialty. Next, identify the equipment, technology, and personnel requirements through each step of that journey. And third, incorporate the specialty standard operating procedure map into your procedures manual and train your team. And last, but perhaps most important, follow up in your weekly team meetings and through regular touches with any of your key personnel that are involved with delivering that specialty. So we're talking about adding a specialty to your new practice. We've touched on financial analysis. From there, we jumped into that physical office and flow, right? Then technology and equipment considerations. We just touched on operations and people. And now last but certainly not least is all about marketing that specialty. Now, look, so there's a world-renowned marketing researcher, Philip Kotler. He's a PhD, right? And he defines marketing as the science and art of exploring, creating, and delivering value to satisfy the needs of a target market. And growing a modern optometric specialty warrants creating a sound marketing strategy composed of three primary areas, that being price, promotion, and presentation. And each of these want to be sure that you optimize utilizing data analytics. So your pricing strategy should ensure that the specialty is priced appropriately to be a profit center for the practice. You never want to undermine your bottom line or incur an opportunity cost when growing the specialty in the practice. So this is going to involve optimizing any vendor suggested pricing strategy with your local geospatial analysis. And then from there, you're going to benchmark with what was already identified in your financial pro forma, that financial analysis. By the way, if you're looking for a deep dive into that, we got a ton of resources at the Cold Start Corner at Akrinos.com, all about creating your financial analyses, your financial pro forma, including some calculators that you can use. So we're talking about promotion with your marketing. We hit on pricing. So now we're talking promotion. And this refers to all of the external touch points, right? With the goal of engaging and effectively communicating the value of your specialty to existing and prospective patients. So here again, utilize digital, your digital analyses, utilize geospatial analyses, right? Understand the demographics of your market, and tons of industry analytics that can really inform that sound promotional strategy to attract that target audience. Also, be sure to incorporate digital, community, and in-office channels to maximize that omnichannel exposure and engagement. So the third component of your marketing strategy here is all going to be about presentation. So the presentation elements of this specialty marketing strategy refers to the when, the where, and the how that the need is being identified, treatment is prescribed, and the patient is committed to receiving care, right? So this stage is where it all comes together. It's heavily reliant on your team's alignment and ability to effectively communicate with the patient. Well, there you have it, right? So what are you waiting for? Go for it, right? So there's so many growing specialties across modern optometry. It provides much needed care to patients and also a tremendous opportunity for new practice owners to hit the ground running, So if you're looking to implement that strategy to add a specialty to your new practice, remember, it's about optimizing your financial analysis, your physical space and office flow, your technology and equipment, your operations and people, and your marketing strategy. If you're looking for more great content like this and just a ton of really great stuff, interviews with thought leaders, tutorials, resources, calculators, what have you, visit the Cold Start Corner at Akrinos.com and be sure to follow Akrinos across the socials. We've always got really great stuff getting on out there. So lastly, wherever you are in your journey to plan, develop, and launch your modern cold start or purchase that practice, we are wishing you all the best and know that Akrinos is on your side. On behalf of all of us here at Akrinos, I'm Eric Matei signing off.